Okay, so I'll proceed if allowed. So as thank you. I'm Stephen Ouma Orongo. I am a sign language interpreter here in Kenya at Maseno University, and I'm also a student in the same institution taking a Bachelor's of Education in Special Needs. You realize I'm an interpreter, but doing special needs. So that is some part of the challenges I'm talking about in this paper. And maybe first of all, let me tell you who Stephen Ouma is. As I've said, a sign language interpreter at Maseno University. I also help guide students during practical skills in Kenya Sign Language course at the university. I'm a director, TOSCOM Alternative Communications consultants, where we work with West Kenya Deaf. This is a DPO, Disabled Persons organization here in Kisumu. I sit in the board of directors for Kenya Action Disability Development Network as one of the directors. I also sit at the board of the Redress Secondary School for the Deaf, where I'm a board member for a second term. I'm a locum staff, majorly helping in sign language interpretation in different government and non-government organizations here in Kisumu, namely LVCT Health, Kisumu County Government, the National Council for Persons with Disabilities, and the Association for the Deaf here in Kenya. I voluntarily chair the Kenya Sign Language Interpreters West Kenya chapter. I sit in a local implementation committee for Kenya Sign Language Bill. We'll talk about it here as one of the solutions we are finding for the challenges we have. And I also sit in the Disability Technical Working Group as a member here in Kisumu County, Kenya. Away from that, I work with the community to sensitize and create awareness on deafness and use of Kenya Sign Language. I mentor young interpreters, and I champion for deaf rights and Kenya Sign Language advocate. In the past, I've been a freelance interpreter before I joined Maseno University. And I've also been a teacher at Machako School for the Deaf here in Kenya, Greenhouse School by Deaf Aid Kenya, that was in Nairobi, and Nyangoma School for the Deaf. Nyangoma is one of the oldest schools in this country and gave birth to the Father Odra School that I'm currently a board member. So my work is dedicated to a senior colleague and friend, the late Jack Owiti, who zealously worked in interpretation, training, research, and documentation of Kenya Sign Language. So Jack always insisted that the listening eyes should get the value from the talking hands. So as I've said, he was an international sign language interpreter, trainer, deaf rights advocate, and mentor. Jack at one point was Wesley rep for Africa. And while he was passing on, he was our vice chair for our association here in Kenya. And before he passed on, he passed to me this work. Unfortunately, may his soul rest in peace. If I could share a link to his blog, and you could read more about him. Next, unfortunately, because of technology, I could not share my screen. I have a diagram which I can explain. In 1990 backwards, this is our memory lane for Kenya Sign Language interpreters so that we understand the challenges we are experiencing and see how best to sort them out. 1990 backwards, there was the Association of the Deaf that was just coming up, and an institution called Kenya Sign Language Research Project that trained basic Kenya Sign Language. Come the year 2000, a volunteer organization from the US came to Kenya and taught the first group of interpreters. And after the training, then evolved our association now called Kenya Sign Language Interpreter. I mean, the sign language, Kenya Sign Language Interpreters Association was formed. And that's the association that we subscribe to date here in Kenya. And in 2020, erupted COVID, and a raft of issues came up. Some had been there before, but some escalated due to the corona pandemic. And I also have a diagram presenting someone in a mask. Generally here in Kenya, people are walking in masks, and interpreters are part of the Kenyan public. So you realize sign language interpretation depends a lot on facial expressions, lip reading, and all that. Unfortunately, when you are in a mask, it is not easy for someone to read the lips. Someone asking, sorry, I don't have any link to the slides. If I could screen share, let me try again. I hope I'll be able to give you the slides in case I'll be able to screen share. Oh, thank God it's here. Okay. So this is the diagram I've been talking about. So that is the face of the interpreter. I'll just go to the diagram. That's the face of an interpreter currently. And as I've explained, I'll just proceed to my next slide. The aims of this research, as I've said, is to dig into some of the challenges we've had and try to propose possible solutions to the same. So my work is not academic because of my level, but it's purely experiential. So the design of this work is that I did desk review of literature by sign language users here in Kenya. I'll also share personal experiences and also experiences of some of the consumers of sign language. So some of the issues that came out during my research is redundancy of sign language interpreters in meetings because of COVID, or in some cases, they are reduced to a single interpreter interpreting for a whole meeting, the whole day. And that's a real challenge because you'll find in is technology. And I would tell you here in Kenya, not every part of the country has electricity. Internet is also unstable in many parts, and the bandwidth cost, which is a challenge. We have a challenge of tactile sign language because the Ministry of Health here in Kenya talks about reduced physical contact with surfaces or people, because those are some of the ways in which COVID is escalated. We have reduced capacity, time, and levels for professional training and development of upcoming interpreters. Because again, as a COVID protocol, convergences of people coming together are not so much encouraged. There's lack of national regulatory standards in terms of training, recruitment, and remuneration of sign language interpreters. So again, here I would share an experience where an interpreter called me at some point, asked me that she had an interview and she was attending and she wanted my advice. On arriving at the interview, that is recruitment, there was no sign language consumer in the panel, no interpreter to interpret for the consumer if he or she was in the panel. So I don't know how the panelists could gauge the effectiveness of the interpreter they were going to recruit. The stigmatized perception and low prioritization of attitudes of non-signers towards sign language interpreters, as well as the deaf. Interestingly, a friend invited me to their college. It's a theological college somewhere in Nairobi, Kenya. And when I went and I was introducing myself as a sign language interpreter, I see guys, adjusting in their seats and adjusting their eyeglasses. And it really rang a lot in my head. Later, my friend told me that some of those people regard sign language interpretation as a cult or something. And I couldn't really understand. So there are job losses owing to reduced staff in many establishments, offices, and this has affected sign language interpreters as well as our clients who are deaf. Lockdowns and curfews has been a problem because interpreters have not been provided with the essential service provider pass. So this has been a major hindrance, and myself as an interpreter in this region, I get calls sometimes from clients who are very much in need. They are facing danger and they need help. It is late in the evening. I really have to drive so fast, go and get them settled so that the next day they can sort out others of other issues that they have. But that is not with every interpreter here in Kenya. Not every interpreter drives, not every interpreter have those opportunities to arrive in time, and they need passes so that they can deliver. So we'll be talking about redress. Interpreters, attitudinal barriers, poor understanding and adherence to sign and language interpreter code of ethics is also a major problem. This has been there pre-COVID, but COVID situation have escalated it because there's a problem with the transport where vehicles carry less numbers, they charge high, and arrival time is influenced, which is in the code of ethics. Unfortunately, some interpreters come not dressed appropriately to functions. And I dare say some are advocates of sign exact English rather than Kenya Sign Language, that is the official language, is the language of the deaf here in Kenya. And that is what we use in sign language interpretation here. We have inadequate research and development of Kenya Sign Language because during any research, someone must go into the community of speakers, see how they manipulate the language, and then how they use and all that so that you can develop that language. So COVID escalated that. We have stagnation of in the legislation of KSL bill. I earlier said I'm in a committee, local implementation committee. So the KSL bill, much as we look at it as a golden bullet that we need to use to tackle some of these challenges, it might also need some other things. I'll be also talking about KSL bill later. My video stuck, but sorry, I'm experiencing some problems here with technology. Maybe I'll be able to go back to my other slide so that I continue in this view. So I have a beautiful photo here by Audrey talking about call me an interpreter, and not the many funny names most people used to call sign language interpreters. Some talk about a signer, a helper, a caretaker, a partner, or companion, or an aide or an assistant. And some talk about a translator, which actually are inappropriate words to refer to a sign language interpreter. I heard this from the opening remarks, and it also appears here. Seems it's a general problem. When I've talked about the challenges, then I now would wish to talk about redress mechanisms, where we need to have state and non-state actors abide by the law. And this, Kenya being a signatory to some of the international instruments like the UNCRPD, we also have our own Kenyan Constitution 2010 and the Persons with Disability Act that talks about inclusion, actually disability inclusion, and this disability is wide. So it should not be focused to one side. So if the government or state and non-state actors can abide by this, then it's going to be a good way of redress. We need to have awareness creation and capacity building and mentorship programs. We know, like the case I was talking about in the theological college, it was quite, I didn't understand, but when we create awareness among our people, then they start to realize that sign language is a language and it's not a cult, and it's not a language inclined to any ethnic group. So that you talk about, like in Kenya, we have different ethnic groups. Someone will ask you, what is this signed in this language of this ethnic, you see, and the other one and the other one. So if we could understand that we have a general Kenyan sign language and the public is aware, then it can help. Again, when I talked about tactile sign language, it is a real challenge. We don't have any redress mechanisms yet, but we talk about adherence to the Ministry of Health protocols in terms of COVID-19. Another way of redress, more particularly on the continuous professional development, which is a strong pillar in every profession. KSL bill that I talked about is going to help us because it's establishing mechanisms of training, recruitment, all that line. So in that manner, we are going to have interpreters able to develop professionally from after high school, that is secondary school here in Kenya, to college or university. And I'm going to again show you that when we reach the KSL bill, which I have as part of my talk. We need to have the government coming in to support the Association for Interpreters, because you realize as of now, the association tries to get subscriptions from members. The same members have lost jobs, so some are not really able to pay. Meanwhile, the association must access all interpreters in the country, administer matters in office, and do a little trainings here and there, and different other logistics. So again, when we talk about absence of policies, The Association for the Deaf here in Kenya and the Interpreters Association have established a a legislative process that is trying to address the matter concerning different areas that affects use and development of Kenya Sign Language and Kenya Sign Language interpreters moderation. As a repetition that we need sensitization to the public so that we don't have the perceptions that we see out there about what people think and different ideas about a sign language interpreter, the Kenya Sign Language and all that. So a good thing where we have really succeeded with the most civil society organizations and advocates of disability and the deaf is that so many organizations have advocated, and in many places people simply work on shifts or working from home to reduce congestion of people in offices. We need to have a policy formulation, although I dare say Kenya is a bit technical, and many states I know, because we are not starved of laws, but adherence to the laws is the real problem, because you'll find an executive arm of the government ignoring orders from the judiciary. So even when we are working on KSL bill, it might not really work if we don't have goodwill of the government. Again, the National Council for Persons with Disabilities, in collaboration with sign language interpreters, can work on having interpreters acquire passes so that in case of need, they can always deliver services that are timely to the clients, whether it's in the police station, in a health center. I've been called in a hospital where a client was sick, trying to communicate to the doctor can't get anything, and the doctor doesn't know Kenya Sign Language. So again, this happened at night and it was hectic. I tried and managed, and I was happy to have done that. The pandemic period has also escalated the problems or challenges with the code of ethics. This is clearly in the KSL bill, and there is also a redress way in our Kenya Sign Language bill. I'm going to talk about that at the bill. And again, as a discipline that evolves and develops in trends, like any other, you'll find different other professionals having their teams developing in all levels. We would wish that in the sign language interpreters, after completing secondary education, they can do a certificate training, diploma training, undergraduate in Kenya Sign Language interpretation, rather than me here who is an interpreter at the university, but grappling with special needs education so that as I go up, I still remain relevant. Currently, we don't have undergraduate or even diploma in Kenya Sign Language interpretation in this country. So if that can develop, then we are good to go. In conclusion, I would wish to say that there are so many gaps we are experiencing, and many stakeholders have confused this profession with industry or even business establishment. And if we can have actual inclusion of the deaf, where interpreters will be involved so that communication mediation is complete, and the championing of societal attitude change through awareness creation, sensitization, then we can have a change. Then speedy legislation of KSL bill into an act. These are really lagged behind, has really lagged behind. establishment of sustainable and innovative solutions for the sign language interpreters body. So again, this is, I hope you can still view my screen. This is Kenya Sign Language Bill 2021. I just took the topics that can give an explanation. That we have preliminaries talking about a bit of explanation, establishment and administration, where the bill seeks to establish a Kenya Sign Language Council that is going to be a whole thing from national to the grassroots. Access and non-discrimination. This is access to information and non-discrimination to the Kenyans who are deaf. Accreditation and registration. This is where we'll be talking about training of interpreters, certification, licensing, recruitment, and all that. Financial provisions in Part 5 refers to financial provisions of the council established in Part 2. And miscellaneous provisions discusses many other things, including the code of ethics. And should an interpreter go against the code of ethics, what is the redress mechanism? So just there I have some of the activities we do here at the lakeside city of Kisumu as Kenya Sign Language interpreters. The first photo, we were at a conference where deaf people attended and we were interpreting in universal health coverage. That's the next is me mentoring students at Maseno University. Some are interpreters. The next is UN Day celebration in 2018, where the country held the national celebrations here in Kisumu. And I have a DPO there who is doing exhibition of what he does in his group, West Kenya Deaf Development Group. And the one in the middle is the current Minister for Finance here in Kenya. That's me. That was pre-COVID. Then the last in the top row is me. When COVID came in, I produced a video which was disseminated to deaf people here in Kenya to teach about COVID-19. The next is training for the DPOs, disabled persons organizations. Then we also have a meeting, advocacy meeting with the leaders. Then Keslia West Virtual Forum, you can see, although my picture is small, you can see the attendance, very minimal. This is a meeting I was chairing, and because of the challenges we are experiencing, most people could not attend.
Dear, sorry for interrupting. You just have 2 minutes to finish your presentation and we will need to move on to the next speaker. Thank you.
Okay, thank you too. So the next is my friend Joyce, who has walked me through this journey. She is also a collaborator. She has offered to, she's a mental health specialist, and she has offered to help so many interpreters who have mental health issues, stress, and what have you. We need many other people like her around to help interpreters as well as the deaf. We have Kislia Forum where we had an activity, and after it, we had a postmortem where we engaged to discuss matters sign language interpretation. Finally, this is me back again, and this is my location where I work and my contacts. Thank you very much, dear listeners. I now wish to ask for any question or comments, and I'll be glad to hear you. Thank you. Thank you, I'm done. So maybe I invite any questions or comments.
Yeah, if any questions appear, they can go in chat and you'll be able to answer. Thank you very much, Ouma, for such a wonderful presentation. I'd like to invite Obed to moderate the next session we have.
Thank you so much to the previous speaker. My name is Obed Mambwe. I'm currently supporting WASFI as the African regional representative. So once again, we ask that those who are on Zoom, you switch off your videos and your microphones. And of course, we have international sign interpretation, and my next presenter will present in English, but we have interpretation in international sign. We also have captions in English, and probably other sign languages too are being interpreted. So if time allows, at the end of my presentation, we will allow a 10 to 15 minutes time for questions. Of course, you can post in the chat your question, or if you want to sign, just post capital letter Q in the chat box, and then capital letter IS in the chat box, and then we'll allow you to ask your question. So I will now introduce my next speaker. They are Belgian names, so forgive me if I mispronounce the names. But the topic that they're presenting is the Belgian Deaf and Hearing Interpreting Collaboration during COVID-19. And this presentation will be presented by one, Caroline Dogen, forgive me if I'm mispronouncing your name, and Nicolas Hanquet, and Delphine Lemarie, and Elke Paulet. I'm looking forward to having the correct pronunciations of those names. Please forgive me. So the floor is yours. You have about 40 minutes to give your presentations, and then after that, you have questions and answers. You may go ahead. Thank you.
Can we please ask the technical